Dr. David Nicholl joins me from Doctors Association UK, who've led the extraordinary general meeting that took place at the Royal College of Physicians earlier this year to address concerns over physician associates. Is this what you wanted to see, Dr. David Nicholl? Thanks for joining us.
Well, thank you, Sheila. We're very pleased to see this review. But, I mean, obviously we need to see what that review comes up with. The concern in many ways is this legislation got passed, so the GMC is actually going to be taking over regulation in less than 3 weeks' time. So I guess what happens is...
What does that mean? Sorry, the GMC is going to what?
Well, in the same way I'm registered under the General Medical Council, physicians associates are going to be registered. And obviously there's going to be a tremendous amount of uncertainty about where this is. And the single question that hasn't been answered, and something that I've been raising for the last 18 months, is what is their scope of practice? What does a physician associate do that is different to what a doctor does? This could have been answered, and I have to say it's a big mess on behalf of really the medical establishment, the way this has been dealt with politically, and in particular the GMC. We are good to see a review.
Who should answer it?
Well, I think, a review is the way forward. And I do have a lot of faith in Gillian Lang. I think she's an excellent clinician. We'll need to see how it goes through. I have a healthy degree of scepticism just because of the way the GMC have managed this. And there have been other national reviews on other issues where the GMC hasn't necessarily paid attention to the review. I would urge everyone to pay attention to the review, to submit evidence, because this has been a big mess, both from a patient's point of view, even physicians' associates' point of view, and also doctors. And
in my conversation with Wes Streeting, a clip of which we played there, that was a week, 10 days ago, he seemed to accept that they are being wrongly deployed in some instances.
That's correct. And I think probably the most important role that a doctor has is making a diagnosis. So you actually give a number of examples of, going for your flu jab. You don't need to see a GP for that, okay? And actually, given how difficult a diagnosis is, you want to be having the most expert people involved in doing that, not people doing a 2-year course. And, I think this is a kick up the backside for the GMC. Ironically, I use that term because it's the ARSS scheme, which is in primary care, which is specifically money to fund people like physicians associate to see people with undifferentiated symptoms, which is just bonkers and really risky.
So explain that to me. What do you mean, undifferentiated symptoms?
So the example of this would be Emily Chesterton, for example, who presented with calf pain multiple times, got fobbed off, never actually saw a doctor, and then died of a pulmonary embolus, basically. So although we joke about this, it has really grave consequences.
Well, that's a shocker, isn't it? Because I know the case you're referring to, because I barely passed a biology O-level, but I know that if you randomly get calf pain, that could be related to the threat of an embolism. And I'm nobody. I'm just a person. I've never done any medical training for a second, and I know that that's something to be investigated. How could you be sent away again and again and again?
Well, I still think there's lots of different causes of calf pain, okay? And that is why you train people in medicine to be doctors, because what you don't want to do is either overdiagnose, so essentially refer in everything as a potential pulmonary embolus, and so that's why it's really important to have that skill mix. And I mean, this is such a mess that we've seen. It's unbelievable to say this, but it's true that, GPs unable to get work, okay, because of this ARSS scheme. So unemployed doctors, whilst we're, and indeed there was an undercover report that Panorama did, I think of the GP surgeon in London, where they, completely open about this. It was a cheap form of delivering healthcare, but the actual costs of this could be much greater.
Well, and at cost to life, yeah.
Absolutely.
And the question of unemployed GPs, is that simply because posts aren't being advertised or created and advertised?
Aren't being created because this ARSS scheme, the money cannot go towards employing GPs. And yet this is for getting people to see people with undifferentiated symptoms. So in other words, you don't know what's wrong with you. You go along to your GP surgery and you may not necessarily be seeing a GP. Now, I think with this review, it is really important. I think it's going to put the spanner in the works on this, and I think it's just going to be employers are going to end up looking at this as just too much hassle. to employ. But that's also an issue. I mean, I think it's actually scandalous the way universities have set up courses in this, and the PAs have been, told this is a way to get into medicine, and they've been sold a pup.
You talked there about the scope of their role isn't satisfactorily defined as far as you're concerned. What I don't want to do is frighten people who tomorrow might find themselves being seen by a physician associate at their GP and think, oh my God, this is terrible, this is poor care. We do know a bit about what they could do, don't we? That they can take a patient's medical history, they can conduct physical examinations, analyse test results, diagnose illnesses, come back to me on that, and help draw up the plan for managing a person's condition. But as you said, they do 2 years training, not the endless years that a doctor has to do. But if that alone were the limit of their job, would that be sufficient for you? Would that be okay with you?
I think the question to ask, and this is a question to ask for every specialty, and there's something like 46 different specialties in which PAs are involved in, is ask each of those specialty associations, what is your role for PAs? How does this help or indeed hinder, okay? And ask, is there a role within that specialty? And the answer may be yeah or nay. And also involve your doctors in training. So in primary care, there should be discussion, within the Royal College of GPs on how this would work. Are there going to be knock-on effects that, as I've described, GPs not being employed? So that's why I say this hasn't just been a political mess, it's also been a medical education mess, and I think important lessons to be learned as part of this review.
And from a patient perspective, what should we feel able to ask about this?
Well, I think that this isn't just true for PAs, but anyone. You need to know who you're speaking with, and indeed there was a really good geriatrician who's no longer here, who described this as the Hello, My Name Is campaign, and actually it should be the same thing that let's say, Sheila, you're my physician's associate. My name's Sheila Fogerty. I'm physician's associate to Dr. Nicholl. You know who you are and who that person is responsible. And it is actually about accountability, so that when you see a physician's associate, you know who they are responsible to. And that is also an issue because, in fact, if the kind of disaster that, the Emily Chesterton type scenario, is actually ultimately the doctor who is responsible for supervising this. And that creates its own problems, is that doctors are not willing to supervise them because they're worried about the medical legal consequences. What
would the best outcome be for you of this review?
The best outcome for me would be getting a properly defined scope, looking at actually the university courses, how this got set up. In fact, the Daily Telegraph looked at this. I mean, some of the entry criteria, I'm not making this up, was even a homeopathy degree, okay? Even though I'm sure there are other people who are probably very well qualified. And I think the issue, probably bearing in mind PA's been around for 20 or so years, back in the early days, you'd had a very small number of very experienced, maybe they've been in other aspects of healthcare, going in, and what we've now seen with these university courses expanding hugely.
Do you know what's interesting to me is that I have always taken an interest in, as a journalist, in health, in NHS issues and social care